It's National Nurses Week. This is an effort to acknowledge the contributions of nurses and call attention to their working conditions. National Nurses Week begins each year on May 6th and it ends on May 12th, Florence Nightingale's birthday. And of course, Florence Nightingale is the founder of modern nursing. Nursing is the nation's largest healthcare profession with nearly 4.2 million registered nurses across our country. The federal government projects that more than 203,000 new registered nurse positions will be created each year from 2021 to 2031. As you know, the pandemic obviously was really difficult and really hard on our healthcare workers. In the beginning, there was uncertainty about how contagious and dangerous COVID-19 was. Then there was staffing issues at the hospitals as more doctors and nurses tested positive for the virus. A nurse tech took Caitlin Ross behind the front lines to help understand what they really went through.
The days start early for VA nurse tech Willis Hatfield-Rivas.
I have to wake up at 4 in the morning just to get mentally and physically prepared to show up at 7:30.
The retired Army sergeant signed up to serve at the VA hospital in Decatur at the beginning of the pandemic.
From the time we walk in to the time we leave, we're just exhausted.
The work is draining, but Willis says it's worth it. He enrolled in the Army after 9/11 to serve his country. He joined healthcare workers during the pandemic to continue that mission.
Not only am I taking care of patients, I'm taking care of veterans, my brothers, the brotherhood that we're living with.
Willis says he's taking that dedication he learned on the battlefield straight to the hospital every day.
And it takes a special type of mindset and a special type of heart. I'm a veteran, I have a warrior's mindset, and I'm willing to come in and get the mission done, but at the same time, I can't treat my patients like missions. You know, I have to treat them with care, be thoughtful and very kind.
A new Duke University study shows healthcare workers' level of burnout is worsening.
I have to make sure that I stay mentally, physically, and spiritually fit at all times. I do not take this lightly at all. And I just really want us nurses to be appreciated because we're just really undervalued.
He says pay raises and more healthcare scholarships could help bring needed help into the field in the long term. At the very least, this serviceman wishes people would acknowledge just how hard this is.
I want to stay in the trenches. I want to stay on the front lines.
Even before the pandemic, hospitals were short on nurses. COVID-19 made that situation much, much worse. So now colleges are starting to see a record number of people interested in nursing. Just a few years into the pandemic, Emory reported an unprecedented uptick in nursing school applications. They say the interest comes at a critical time as nursing shortages continue to impact hospitals across the country. According to the nonprofit Georgia Center for Nursing Excellence, the state will need to replace more than 30% of the nursing workforce over the next 5 years due to nurses leaving or retiring, plus turnover and growth. And some students say knowing how shortages can impact care is what's keeping them motivated.
I don't want it to ever be that I have a family member or myself in the hospital and there's just not enough staff. And I think that I want to do the little part that I can. I think despite the COVID pandemic, it's actually more of a reason why people are going to nursing school.
You know, last fall we checked out Emory Nursing's new learning center, hoping to be part of the solution to a nationwide shortage. 11 Alive's Liza Lucas shows us it's not the only program working to solve the problem.
Georgia needs more nurses, but there are obstacles, including a lack of space for training.
Lack of faculty and lack of clinical rotations are the two main reasons why we can't prepare more nursing graduates.
Emory Nursing aims to overcome part of that challenge with its new $20 million simulation facility, which mimics a hospital floor. School leaders say the lab gives Emory the ability to train more students in a real-life setting.
We can use this facility versus going into a hospital. If we spend half of our education in this facility, that means we can have twice as many students.
Increasing the number of nursing school students is critical as the need for more nurses grows exponentially. Other schools are also working to make sure they're not turning away eligible students. A spokesperson for Berry College confirms the program plans to double its number of nursing graduates thanks to a $5 million donation, while Georgia State University plans to expand its nursing program to 250 students, more than 3 times its current number, thanks to a partnership with Grady Hospital. Meanwhile, Emory's New Learning Center plans to not only focus on its own students, but reach high school students, with hopes to inspire the next generation of healthcare workers.
Certainly, we can focus on the nursing shortage, but We need unit clerks. We need care assistants. We can introduce high school students to that here.
Recruitment is just part of the solution. Retention, keeping nurses happy and on the job, is also a very important part of the equation, something these programs and hospitals are actively working on. Indicator, I'm Liza Lucas, 11 Alive News.
So here's something you don't see every single day: a hysterical cry for help in a health center parking lot. Evelyn Davis is a registered nurse, so she was flagged down at work after an expecting mom and her grandmother pulled into the parking lot, and the woman was ready to deliver her baby.
So what I do is I introduce myself to the mother, because she was hysterical, understandably, and I calmed her down and let her know that we were here to help her. So at that time, she still wasn't breathing. So we had her wrapped up, and so I started rubbing on her chest, and I was like, come on, baby, breathe, breathe, breathe. Come on, take a breath, baby. And I just rubbed on the baby's chest, and then she let out a scream.
How awesome is that? So Evelyn helped deliver the healthy baby girl, and mom and baby were taken to the hospital to get everything checked out. For a pair of Atlanta sisters, nursing is a family affair. 11 Alive's Liza Lucas spoke with them about what it means to help mothers and new babies at Northside Hospital.
I think I have probably the best job in the world.
For Jenny Andrus, caring for the moms and new babies in labor and delivery is a passion found in her own family's experience.
I was entering high school when my mom was diagnosed for the first time. I got to see the role that Northside provided in her care, and I got to see how the nurses and the doctors, the techs, everyone kind of helped her through that journey.
Time spent at Northside Hospital inspired Jenny to become a nurse, and turns out it runs in the family.
I always wanted to be able to take care of someone like they took care of my mom. It's really all I grew up knowing.
A decade after Jenny, her sister Amy, a rising senior at Georgia Southern University, will now join the ranks of Northside nurses, part of the hospital's extern program. Amy just starting her career, having seen her sister work through a pandemic.
It was very scary in the beginning, when we didn't know how it was spread or how infectious it was. But ultimately, I just realized this is what I signed on to do in nursing school. You will be walking into people's lives and their situations where they are really sick, and you do need to help them.
That need to help includes guiding a new generation of nurses like her sister.
For us to see this excitement, this eagerness, this general passion for the field, it's kind of reminded a lot of us why we started.
And for Amy, there's excitement to begin her own path while working alongside the one who has inspired her along the way.
I've seen her love her job for 10 years, and watching her go through those ups and downs is really what makes me want to stick with it even more.
We at 11 Alive want to say thank you to all the nurses out there who put themselves on the front lines to make sure our communities, our families get the necessary care. And be sure to send a little extra love to the nurses in your life this week.